Dante, what's going on, my boy?
What's going on? What's going on? Hold on. Before we get into anything, I've been jealous. All y'all drinking all night. I gotta get in on this, man. Listen, Mike, I don't know you like, hey, I've been watching and I know you like that, but let me tell you right now, this the real drink you need right now. Especially make sure you get some of that. Make sure you go get some of that right now. Listen, I just been watching. Hey, my job is to care for you first, man. It's health first. We gotta get you some of this. Let's get some of this. I can short it with y'all though. Let's go. Hey, with you, bro.
This is a real doctor.
Right. I gotta do it.
Doc, you can't do it to me, Doc. Y'all say y'all don't trick people, but y'all tricking me, man.
No, man. We ain't trying to trick you. Hey, off the clock. You see what? This ain't fake. This real. But I got work tomorrow. I can't be chatting with y'all, man. I can't hang with y'all. What y'all saying?
All right. So, chilling, Doc. Mikey. Yeah, Mike, do something with your mic. I can't hear you no more. It is low. Thank I can't hear you either.
I can hear you.
That might be your phone. All right, I can hear you good now. Okay, good. So, Doc, first and foremost, we would love for you to say, first of all, your name and your level of doctor.
Level of doctor. Okay. So for everyone, my name is Dr. Jacobs. Dante is my first name. I'm a family medicine doctor by specialty, if you want to call it that. So I deal with adults, children, even pregnant women, geriatrics, older people. I work primarily at the family medicine clinic right now. That's on Collins Avenue. That's the public clinic here in Nassau. So you may have a relative that goes there. I might have seen them or treat them now. So essentially, I focus on the family, so from children straight up. But my platform, Body, Temple, Health, and Wellness, is a health education platform that I developed basically to get to you guys, to get to the community, get to the young people, trying to make everyday counseling that they do from day in, day out, basically the things you should be doing at home so you don't have to come see me in the clinic or in the hospital, right? So, essentially, it could be as simple as, hey, make sure you drink 7 glasses of water a day. Make sure you have 5 fruits and vegetables, So simple things like that, things that you should already know, but the doctor just giving it to you for free online, on YouTube, Instagram, what have you. So, yeah. So, doctor for the people, in short.
Dr. Jacob, we can call you Doc tonight. That's okay?
Well, you call me whatever you want, man, bro.
All right, good. So, let me ask you a question, Doc. Doc, we're going to ask you some questions in reference to COVID-19, the vaccine, treatments, and we might stray into some other things if that's okay with you.
Yeah, man, that's good. Let's get into it. Whatever you want to ask me, man.
Okay, so I want to caution you that my audience is a straight up and real audience. They ask all questions that they love to ask, and hopefully you can answer all those questions. Well, some may be a little tough, but hopefully you can answer it for us. So my first question to you is reference to COVID and COVID-19. Can you speak to how serious of an issue it is?
Sure, man. That's so for my people out there, so definitely there's a certain younger set. So I could tell you exactly what I experienced myself. I worked on the ground level at the COVID-19 center at Princess Margaret Hospital about 2 weeks ago, literally. Just me and a few other doctors having to take care of a huge number of people. And literally I had to cover the night. And on that shift, okay, I literally had to see 3 people die, okay? 3 people die in front of my own eyes, okay? Trying to save their lives. Every last one of them were gasping for air right before they went, okay? Before they crashed, every of them kind of went into the same scenario. They got the full treatment of COVID management but there was nothing that we could do, all right? They got the full management, but essentially at the end of the day, these people passed on. And I'm talking literally, we're trying to resuscitate, trying to push on the chest, bring them back to life. Nothing's happening. And then I have to go and call these people's family. All right. You can imagine if you, having to call your mother or call your grandmother at 11 o'clock at night to tell her that y'all passed away. It's a different kind of thing when you see that head on, you know. And you may not hear these things in the news or what have you, but this is what's happening. It's not happening last year. This just happened 3 weeks ago, okay? And that's still happening now. I can just tell you, it's the wild, wild west right now in terms of this COVID. Like, I don't want y'all to think that, oh, no, this just some light thing just floating around. I can catch it until I see it. No. Like, for some people, best case scenario, they get a little cough and cold, go about your business. But for the majority, they're coming in bad shape, and some of them are not making it up. So, you know, however else I could explain, I could just tell you that, you know, it's not a gimmick. It's nothing fake about this. This is real, and this is now, okay? So you guys we gotta do the proper steps, you know, the safety steps, the best thing for you, you know, for you and your loved ones.
All right, fair enough, fair enough. Next question, are you vaccinated?
Yes, sir. I'm fully vaccinated with the AstraZeneca Oxford vaccine.
Okay. And are you pro-vaccination?
I'll put it to you like this. I'm pro anything that gets you, Guidance Mike, and Tank next week. So if it's vaccination, if it's wearing your mask, if it's socially distanced, if it's wearing a rubber twice and 3 times, if it can get you the next week, Dr. Jacobs gonna promote it. Okay, that's our job as healthcare professionals. We didn't create these vaccines. We wasn't there when they was making them, but we read studies. That's how all doctors work. We look at evidence-based research, okay? And we use that to make conscious decisions for our patients. And right now, it's the best option to help get some kind of grip on this COVID thing. It's not perfect, but it's the best option right now. If they have a better one tomorrow, Dr. Jacobs is going to recommend that. But unfortunately, we're not there. This is the best option right now to get some level of control over this thing.
Is there any vaccine, like, okay, is the Pfizer or the AstraZeneca better than the other? Or which one?
Pfizer?
I think he meant Pfizer. I think he meant Pfizer.
Pfizer, sorry. The Pfizer better than AstraZeneca.
Wait, y'all don't do it like that, man. Come on, I get it. So you got the Pfizer, the Moderna, the AstraZeneca, and the Johnson & Johnson. That's the big four. Every last one of them are effective. They all pass what they call the EUA, the Emergency Orders Act, basically, right? They're not FDA approved, okay? But literally all that is a sticking red tape that you got to cover for years to get past. So none of them are FDA approved, but that doesn't mean they're not effective. Every last one of them are effective. They do what they're supposed to do, which is to decrease the chances of anybody having symptoms, okay? And having symptoms that would lead them into hospital and ultimately or dying, right? That's the only job of vaccines, all right? The job of the vaccine is not to stop you from getting COVID. Let's bust that up right now. That is not true. It never was true.
So let me ask you a question.
Funny. Yeah.
Is that, okay, you said that's not the job of the vaccine, but isn't that the purpose of a vaccine? To stop you from contracting or stop you from getting whatever?
I'll ask you this. You got the chickenpox vaccine when you was a kid?
I believe so.
Okay. Did you get chickenpox later on? You ever got chickenpox?
I cannot say for certain.
You cannot say for certain.
I believe I did.
You believe you did? Okay. Yeah. So does that mean the vaccine didn't work? So my point is to say that is you didn't get chickenpox vaccine to stop you from getting chickenpox. You got the chickenpox vaccine to make sure when you got chickenpox, you ain't got to go in the hospital. You get a bunch of meds to get IV in your line and make sure you don't die. It's the same thing with COVID. The COVID vaccine is not there to stop you from getting COVID. It's when you do get COVID, if you do, you make sure you don't have to come to the hospital. You don't have to come to PMH or doctors, and ultimately you have to be one of those cases where, you know, you could potentially pass away. That's really what it is, if that makes sense.
You're right. Okay, that's fair. Let me just look up the meaning of vaccine here.
Good.
No, because listen, yes, why, and I'm glad that you're here, and I'm glad you're somebody who we can talk to on this level, because there are a lot of concerns from people like us on our level, things that we don't really understand, right? So I want to ask you some of the difficult questions that we go back and forth daily about what it is about this whole vaccine thing, right?